This video is about the open-toe shoe and its impact on the distribution of pressure, the orientation of the digital bones and the process of placing the hoof. The data presented here were raised by a scientific cooperation between Werkman Horseshoe Factory and the Institute of Veterinary Anatomy Leipzig. The open-toe shoe is a common modification regarding the dorso-palmar level. By turning a shoe around, the closed shoe is formed which is open underneath the toe and thus relieves the dorsal hoof wall. The open-toe shoe used for this study was fashioned from a standard shoe by removing the toe caps and heavily grinding the branches' tips. The bar levelled out with the end of the heels and had little or no contact with the posterior frog area according to the horse's individual hoof conformation. It should be noted that there are several ways to shape the open-toe shoe's palmar bar so that the supporting surface underneath the palmar area of the hoof, as well as the length of the posterior lever arm, can be influenced differently. The manufacturing of some open-toe shoes is demonstrated by Mitch Taylor in the corresponding video. The open-toe shoe is a therapeutic shoe which is applied to support the palmar part of the hoof. It is used in inflammations of the deep digital flexor tendon and illnesses of its accessory ligament. Additional indications are painful processes in the palmar part of the hoof, like chronic inflammation of the podotrochlea and desmopathies of the short digital ligaments, keeping in mind that in these cases there should be no direct pressure on the frog. Apart from that, the shoe makes unrollment easier by setting back the point of breakover. Furthermore, the open-toe shoe is used for the therapy of light cases of laminitis as well as chronic laminitis. As a rule, laminitis is accompanied by damage to the coffin bone suspensory apparatus, which consists of the following structures. Connective fibres stretch from the ridges of the coffin bone to the dermal laminae of the respective capsule segment. These laminae, in turn, interlock with the dermal laminae within the hoof capsule. The coffin bone suspensory apparatus is especially prominent in the dorsal wall segment. When this suspensory apparatus is destroyed by laminitis, the tension of the deep digital flexor tendon, together with the lack of fixation, cause the coffin bone to descend and rotate. The tip of the coffin bone applies direct pressure to the sole so that there is imminent danger of penetration. Supporting the palmar part of the hoof moves the load to the healthy palmar area and removes stress on the inflamed region and the tip of the coffin bone. Also, the steeper alignment of the hoof, together with the easier unrollment, which is discussed later on, lessen the tension that the deep digital flexor tendon applies to the coffin bone. The effects of the standard as well as the open-toe shoe were examined by radiological and pressure measurements. The radiological examinations followed a standardized protocol and were carried out on a firm and soft X-ray block in order to simulate different types of ground. 2 pressure measurement sensors were simultaneously fixed on the hoof, and every examination was carried out on 4 different types of ground. You will find detailed information on methods and the execution of kinetodynamic examinations in earlier lectures on this homepage. Now we explain the open-toe shoe's influence on the mediolateral orientation of the coffin bone in relation to the ground. The barefoot situation as well as the usage of standard horseshoes serve as a comparison. Every radiographic examination was carried out on a firm wooden block and a block with soft padding. On firm ground, the open-toe shoe has no influence on the mediolateral orientation of the coffin bone. On soft ground, there are generally differences regarding the mediolateral orientation of the coffin bone in comparison to firm ground. On soft ground, according to the build, heavily loaded part of the hoof can sink in, causing the angle of the coffin bone in relation to the ground to change. This effect is often intensified in hoof shoe modifications that prevent the hoof from sinking into the ground in that area by a palmar support. It becomes especially clear when the toe can penetrate the ground very easily, which is what we see with an open-toe shoe because of the lack of support in this area. The following images illustrate this. The dorsopalmar alignment of the coffin bone is heavily influenced by an open-toe shoe. The same references as mentioned before were consulted and all measurements were carried out on both types of ground. Even on the firm X-ray block, we see a difference between the unshod horse, standard shoe and open-toe shoe. The hovering toe, as well as the heavily grinded branches tips, which were set back, make for a steeper orientation of the hoof, and accordingly the coffin bone. If sinking into the ground is possible, we discover that the palmar angle of the coffin bone increases compared to barefoot or standard shoe. The coffin bone's alignment becomes steeper. Because of the open toe, the tip toe sinks in deeper, while the posterior part of the hoof cannot sink into the ground as much because of the palmar support. Therefore, the coffin bone's angle is steeper in relation to firm ground as well as in comparison to a standard shoe on soft ground. This relieves the deep digital flexor tendon and the podotrochlear apparatus on soft ground. The important toe-to-support ratio is heavily influenced by the open-toe shoe on firm ground. The open-toe shoe's heavily grinded branches tips decrease the lever arm over which the hoof has to unroll. In addition, the slightly steeper alignment of the hoof lessens the tension on the deep digital flexor tendon during unrollment, reducing the tension on the coffin bone as well. These biomechanical effects are especially helpful in order to minimize damage to these structures when the suspensory apparatus of the coffin bone is destroyed by laminitis. Every horseshoe influences the way pressure forces are distributed across the hoof capsule apart from their effects on bones, tendons and ligaments. Here we demonstrate what kind of ground reaction forces develop between the shoe and ground and how they are relayed to the hoof capsule. First, we look at those pressure forces which develop between shoe and firm ground. Here, concrete during walking. Again, a standard shoe was used as reference. The pressure distribution pattern of an open-toe shoe shows that the toe is hardly located at all and the branches tips carry about 30% more weight, so that there are massive pressure peaks in the anterior area. The bar is saved and subject to less load because of the hoof's steeper alignment. So how does the shape of the shoe and the resulting pressure distribution pattern influence the hoof capsule? We can see that the pressure is passed on from the shoe to the hoof on firm ground. The anterior hoof wall is relieved, while the pressure peaks originating from the branches tips are clearly visible. The lateral walls are subject to more pressure load too. The palmar hoof region as a whole takes less part in the weight bearing, but the frog underneath the bar can be involved according to the form of the hoof or that of the shoe, influencing the area of palmar support as well as the pressure distribution. The open-toe shoe develops a clear effect on soft ground. Here, too, the standard shoe is used for comparison. Looking at the pressure distribution patterns in deep sand while walking, the following becomes apparent. Under these circumstances, the branches are subject to more pressure as well, and pressure peaks underneath the branches tips are visible. The bar sinks into the ground less easily, and thus emerges as palmar support. So to what extent are the pressure forces projected from the shoe onto the hoof capsule? Because there is no support for the anterior hoof wall, it can easily sink into the ground. Thus, a significantly larger part of the sole in front of the frog carried weight. Apart from that, the pressure peaks originating from the branches tips are passed onto the hoof capsule too. Regarding the central hoof area, we see hardly any difference. The posterior part of the hoof cannot sink into the ground as it would do with a standard shoe because of the palmar support. the ground's counterpressure is increased in this area and subsequently slight pressure peaks in the heel region arise. In conclusion, the strain on the anterior hoof wall is significantly smaller on firm ground, whereas considerable pressure peaks are passed on from the branch's tips to the hoof capsule. So, the sole is subject to a lot of pressure in relation to the branch's width. Generous grinding of the shoe's edges can minimise this effect. When we use a standard shoe on soft ground, the frog carries weight as well, because the palmar part of the hoof can sink into the ground easily. As the open-toe shoe has a palmar bar but offers no support for the tip toe, the toe sinks deep into the ground, causing considerable pressure on the solar region in front of the frog. The pressure peaks and the additional stress in the area underneath the tip of the top coffin bone can result in poor acceptance of the shoe. Painful conditions can occur with laminitis, with descent and rotation of the distal phalanx. The footing pattern is formed out of several steady steps which are averaged into one picture. For that purpose, the horses were led along a straight line without lateral movements of the head. The average picture shows the footing, the movement during the main stance phase, the unrollment and the point of breakover. As you can see in these three examples here, with an open-toe shoe, the point of breakover is set back so that it is level with the branch's tips. Depending on whether the horse naturally unrolls more pronouncedly over the inner or outer toe, this tendency is increased by the one-sided unrollment over the corresponding branch. Occasionally we see instabilities during footing. In order to prevent the hoof from tipping over the shoe's edges towards the tiptoe, it is recommendable to grind them. This ensures a flowing transition and makes unrollment easier. In addition, it minimises the lever arm affecting the hoof wall. Summing up, the hoof with an open-toe shoe doesn't sink into the ground as much because of the palmar support, whereas the toe tends to sink in more easily. So, the coffin bone's alignment becomes steeper on soft ground. Based on the biomechanical assumptions of other study groups like Denoir et al., this causes the upper digital bones to descend and the extension of the fetlock joint to increase. The positive effect of the steeper coffin bone angle is the impact it has on the deep digital flexor tendon and the podotrochlea region. Simultaneously, it is assumed that the descent of the large and small pastern bone increases the strain on the suspensory ligaments, the superficial digital flexor tendon, and the sesamoidean ligaments. The described effects on the alignment of the upper digital bones seem to be highly dependent on the individual conformation of the toe, the whole limb, and the ground properties, however. The point of breakover is set back and thus level with the branch's tips. It is important to take the grinding of the branch's tips in order to prevent the hoof from falling from the edge of the shoe onto the toe into account here. The length the hoof has to unroll over, and with it the anterior lever arm, is significantly shortened, which together with the steeper alignment of the toe minimises the tension of the deep digital flexor tendon. Therefore, it is beneficial to use this kind of shoe for horses with illnesses in the palmar hoof region. Additionally, it relieves the coffin bone suspensory apparatus, which has a positive effect on the orthopaedically supportive therapy of laminitis. The pressure peaks originating from the open-toe shoe's branches tips, which are partially passed onto the sole even beyond the solar margin, are problematic. If the solar corium is subjected to too much pressure underneath the branch's tips, this may have negative effects on the hoof-sensitive blood circulation as well. Contusions and lameness follow. In addition, the anterior hoof wall and the sole are supported only minimally, which can cause problems in cases of laminitis with descent of the coffin bone. On soft ground, the considerable pressure on the sole in front of the frog can have unwelcome consequences. The coffin bone lies beneath this area. Especially in cases of laminitis, this region should not be exposed to pressure. When using a shoe modification like this, usually the effects on tendons, ligaments, bones and cartilage, or the modification of dynamic processes, are at the centre of attention. Often the impact on the surrounding hoof capsule takes a back seat. By changing the pressure distribution and the supporting surface, we influence the sensitive blood circulation and the horn architecture significantly. On the whole, all the anatomic structures forming the distal extremity form a close regional and functional relationship. It is safe to assume that relief for one structure causes additional strain on the counterpart, so that the efficacy of a shoe modification has to be evaluated individually in every case.